Hello everybody, welcome to the first video on the skull. What we're going to do here is we're going to introduce the distinction between the cranium and the facial bones, and then we're going to go looking at bones and their specific features and joints, and we're going to do this view by view. So in this video we're going to look at it from lateral view, and in future videos we'll look at it from other perspectives or views. So let's just remind everybody that the skull is divided into two sets of bones, the cranial bones and the facial bones. The cranial bones are specifically the bones that surround the brain, while the remainder of the skull bones are facial bones. So you should know which ones are which. Right? But for now we're going to go ahead and we're going to start looking at the details of the skull. I'm going to begin by talking about the joints of the skull. With one exception, the joints of the skull are sutures. A suture is a non-movable fibrous joint, and we need to know four of the major sutures. We need to know the coronal suture, which can be seen right here. We need to know the squamous suture, which can be found right there. We need to know the lambdoid suture, which can be found right there. And there's a fourth suture, but it's not seen in this view. Now, on a real skull, these sutures appear like deep, squiggly cracks on the surface of the skull. And because they are joints, they are the dividing line between bones, and so these sutures separate one skull bone from another. For example, anterior to the coronal suture is the frontal bone, and the coronal suture separates the frontal bone from the parietal bones, which are shown in blue. Now, there's actually two parietal bones, but you can't see them both in this view. Right? The lambdoid suture separates the parietal bone in blue from the occipital bone in this kind of purplish color. And the squamous suture separates the parietal bone seen in blue from the temporal bone seen in yellow. Right? Let's go ahead and look at the remainder of the bones. The next bone I want to talk about is the sphenoid bone. And a good way to locate the sphenoid bone from this view is to find the coronal suture, and the coronal suture will point to the sphenoid bone. It's shown in purple here. Now, the sphenoid bone has a very complex shape, and its appearance is going to be different in each view of the skull. The part of the sphenoid bone that we see here is called the greater wing of the sphenoid bone. There's one more cranial bone that we can see in this view, and it is the ethmoid bone. And in this view, it's only visible in the orbit or the eye socket. That's just that little bit right there. It helps form the medial wall of the orbit or the eye socket. Let's go ahead and look at the facial bones. We have a pair of nasal bones which form the bridge of the nose. Okay. Adjacent to them, we have the maxilla, which is shown in this orange color. The maxilla helps make the side of the nose and the upper jaw. We have another bone inside the orbit, kind of shown in blue. It's a rectangular bone on the medial surface of the orbit, known as the lacrimal bone. In green, we can see a bone known as the zygomatic bone. This helps make these are your cheekbones. And then at the inferior edge of the skull, we see the only movable bone in the skull, and that is the mandible. Let's take a closer look at this mandible. When we look at the mandible is kind of shaped like the letter L. Okay. The horizontal part of the mandible is known as the body, whereas the vertical portion of the mandible is known as the ramus. On the superior margin of the ramus, there are going to be two structures, right? And there's a left ramus and a right ramus, so these structures are paired, right? This anterior projection of the ramus, that's known as the coronoid process. And the posterior projection is known as the condylar process. And the end of the condylar process is known as the head of the mandible. This is sometimes known as the mandibular condyle. And the mandibular condyle articulates, or in other words, forms a joint with the temporal bone, right? And you can see it right here. It says head of mandible in mandibular fossa. That mandibular fossa is part of the temporal bone. Okay. And then if we come back here to the mandible, we can just round out a couple other structures. If you, the margin of the mandible where the teeth are embedded is called the alveolar process. And if you look on the medial surface of the ramus, you can see this little shaded structure right there. That's actually an opening or a hole known as the mandibular foramen. And that's an opening for a major nerve that innervates your lower jaw or the tissues around your mandible. Okay. Now, let's return to this image right here, and let's look at the structures that are part of other bones, right? And really the only other bone in this view that has specific parts that we need to look at is the temporal bone, which is shown here in yellow. Some people think of the temporal bone as looking like the head of a chicken, right? Where this is kind of like the coxcomb, and then this is the beak of the chicken, and that's the eyes. To me, it's always reminded me of the shape of the continent of Africa lying on its east coast, right? But if you look at the temporal bone, there is a deep opening on its lateral surface right there called the external acoustic meatus. It's also known as the external auditory meatus. This corresponds to your ear canal, right? So this is lined with skin and the subcutaneous layer, and this is the structure that you stick a Q-tip down even though you're not supposed to, right? And a meatus is a deep canal or passageway. Now, if we use this meatus as a landmark or a reference point, we can look anterior to the meatus, and there's this long projection known as the zygomatic process. Now, you'll notice this zygomatic process is colored yellow. It's part of the temporal bone. But it's called the zygomatic process because it connects or articulates with the zygomatic bone. And that is a common pattern in the naming of bone parts. Bone parts are often named after what they connect to. And we saw this in the radius and the ulna. The radial notch is the part of the ulna that articulates with the radius. Just like the zygomatic process is the part of the temporal bone that articulates with the zygomatic bone. If you look inferior to the external acoustic meatus, there's kind of this narrow, pointy process called the styloid process. The styloid process projects inferiorly and helps or connects to the ligaments that help suspend the hyoid bone, which we'll look at later. And then posterior and inferior to the external acoustic meatus is this large rounded bump known as the mastoid process. Right, now this is one of several features you can actually feel on yourself. So if you feel the bony bump of your skull that's behind your earlobe, that's the mastoid process. It's a major site of muscle attachment for major muscles that help move the head and neck. You can also feel the zygomatic process if you put your finger next to your ear canal and move directly anteriorly. That hard bony ridge between your ear canal and your cheekbone, that is the zygomatic process. Let's look at this on a real skull. Here is the coronal suture. Here, right, that's the squamous suture. This is the lambdoid suture. Right? We can, if we label the bones, we have the frontal bone, and here we have the parietal. Okay. Here we have the occipital. Here we have the temporal. And here's the coronal suture pointing us straight down to the sphenoid right there. Okay. We have nasals. We have the maxilla. We have the mandible. Okay. We have the zygomatic bone. Here we can see the lacrimal, and by default, posterior to the lacrimal, we'll be able to see a tiny bit of the ethmoid. Okay. Right. This is the mastoid process. The styloid process is broken off, which is very common in real skulls. Let me clear this out so we can look at some more. This right here, right, that's the external acoustic meatus. And here we see the zygomatic process. This is the mandible, and there's the body of the mandible with the ramus of the mandible. We can see the occipital condyle, or the head of the mandible there, and we would be able to see the coronoid process right there. Okay. Right. And that's the end of this video. I'll see you in the next video for the next view.